Alright, welcome to the lecture on phobias. Phobias fall into the category of anxiety disorders. Anxiety disorder is having a fear of something that isn't justified by the situation. Whereas anxiety disorder can be generalised, phobias are cases of anxiety in more specific circumstances. And there are three generally accepted categories: specific phobias, social phobias, and agoraphobia. Specific phobias usually focus on one thing that is a source of anxiety. For example, having a fear of dogs, which is cynophobia, or having a fear of enclosed spaces, claustrophobia. There are far too many specific phobias to list, and almost anything has the potential to cause a phobic reaction. Sometimes the source of a phobia can seem reasonable to others, such as pathophobia, which is a fear of disease. But sometimes it's hard for others to understand why a specific phobia is so powerful when it seems entirely irrational. For example, trypophobia, a fear of objects with small holes clustered together, like honeycomb or coral. But it's important to remember that the feeling of fear is very real for the individual experiencing it, even though they might also agree that the phobia is irrational. In fact, part of the definition of a phobia is that it is irrational. So just trying to convince someone that the thing they fear isn't really dangerous or frightening is not an easy process. Trying to avoid the source of fear can become a dominating force in a person's life, and it can become disruptive to their everyday functioning and reduce their quality of life. The phobias usually develop in childhood, but can also appear later in life. Thanatophobia, which is a fear of death, is one such condition appearing in older people. This seems to make some rational sense, though. The second category is social phobias, also known as complex phobias. The source of fear in these cases is feeling that you will embarrass or humiliate yourself in front of others. This is a reasonable thing to think in some high-pressure social situations, such as giving a speech at a wedding. But social phobia can make people experience that high level of anxiety in situations that most others would not find threatening. So, just talking to others, eating or drinking in front of other people, or having to write when someone is watching, are just a few examples of when the phobia could manifest itself. The problems usually start in adolescence. And as with a specific phobia, avoiding social situations can be a time-consuming and life-disrupting activity. Someone with a social phobia could find working with others very difficult. Not because they can't get on with people, but because they are experiencing a fear of being embarrassed or humiliated. The third category is agoraphobia. Agoraphobia is a fear of being in a situation where help is not nearby if something happens. It's being away from a safe place, such as home. Because having anxiety and phobias can produce very frightening panic attacks, many of those dealing with the condition worry about experiencing an attack, and being away from a safe place when they do. As a result, they may be very afraid to leave their home in case it does happen. Agoraphobia is also a fear of being unable to escape a dangerous situation, and it accounts for 60% of all phobic patients. As with all mental health conditions, there is a stigma, and a very common experience is for people with a phobia to try to hide the fact they have it. This in itself becomes a further source of anxiety and generates feelings of shame and guilt. Okay, that's it for this lecture. See you in the next.